So, how do you deal with being short-staffed as a nurse and as a CNA? Come back, let's talk about it. Okay, so I have been asked this question numerous times, and I've shared my experiences here on YouTube and in my classroom. So, if you work in the nursing department, you work in healthcare, it's a given. You're always going to have, it's interesting, it's frustrating, it's very annoying, but you're always going to be short-staffed. I mean, the management is going to play one on you. It doesn't matter where you work. It doesn't matter how great that place is when it comes to staffing. Staffing is something that's difficult because I have run a nursing agency before, which is something I might go back to. I'm not so sure, because staffing is a killer. Trying to staff is a killer. It'll get you killed. I hope my lighting is fine because my sweetheart actually got me this ring light, and I might just put the link below because I'm loving this right now. I am so loving it. It's a stand and a ring light, so thank you, babe. So anyway, because he sees how I struggle, some of my last videos, I think some before this. It's interesting because I had this, but it wasn't set up, and I don't know, but we've set it up now, so hopefully, sometimes you get a hold and you're like, ah. But anyway, so let's go back to the topic at hand. When you're short-staffed as a nurse, I'm going to start with the nursing. First of all, because I'm an OG, and I always say this, OG, it didn't just come like one day I got into nursing and I just knew what to do. And that's why it's so important to me to impart my knowledge, because again, when you've gone through experience, you don't panic as much, and it's okay to share your experience. So if you do get short-staffed as a nurse, charge nurse on the floor, you have your own unit, you have your own floor, you're going to have to prioritize. Okay, you're going to prioritize on those things that if you do not do them, the patient will get affected medically. Does that make sense? Now, anything you don't do, as long as it's part of the care plan, will affect the patient. However, they are in priority order. Not everything is going to get their heart stopping or is going to get their breathing stopped. Does that make sense? So those two that I picked out, heart, breathing, they're big. Okay, so you're going to prioritize the kind of care, okay, because you're not Superwoman, you're not Superman. The last time I checked, nurses don't run around with a Superman emblem on their chest with a cape. Okay, now we do have invisible ones though, because we perform such impossible feats. But let's come down to the real world, okay, where again, management will tell you someone is called off, and management will tell you they've gotten in touch with someone that is going to replace the staff that is called off, which is a lie, because they're in their bed and they're happy, and this happens sometimes with night shift. Okay, the scheduler has to fill those holes. Okay, so a lot of times you find that when you look at the schedule, every hole is being plugged, the right staff is there, but when it comes to the day of the job, well, someone is missing, or two people, and you find that sometimes the scheduler plays this game where no one was there anyway. But again, it's a numbers game, and people do this. Management does this, and that's why there is always that disconnect with, between the management and the nurses on the floor, the clinical staff. Anyway, so what do? You're going to prioritize ABC. Does that make sense? Airway. So if they need breathing treatments, they need anything to do with the airway, you want to do that. That's important. Anything to do with breathing, blood, you want to do that. Okay. They need something for their heart. They need blood pressure medication and stuff like that. Those things are important. Okay. What else? The blood sugar. You want to, again, if you work in the healthcare field, diabetics are not people to play with, okay? Because they can bottom out on you. And so those are those people you want to look at. People with heart condition, people with blood pressure conditions, hypo or hyper, diabetics, let's see, people with breathing treatments. Those are the things you're going to prioritize. Those the things not to prioritize: wound dressing. Okay, again, please understand this. The reason why I'm giving you this is because I'm trying to help you, because there are people who don't know what to do. Okay, so if you work, say for instance, now for me, I work predominantly in the nursing home, the long-term care facilities. In the hospital is a totally different kind of beast. Why? Because it's more, what's the word now? You have more, depends on what department you're working though. I mean, they don't get as short-staffed as a nursing home. That's not to say they don't get short-staffed, they do, but you have floaters. They can always move people around because the hospital is big enough to take from here and give there and what have you, so you find those that work in the floors where they have more unstable patients will be staffed, okay? And if there's any kind of short staff thing going on, they can always pull people, okay? In the nursing home, it's not so much like that because there's no staff on the floor. There's no staff in the building. So what I'm saying right now is more targeted towards when you work in the nursing home where you have more stable patients. Does that make sense? Stable as in when you hold off some intervention, nursing intervention is not going to kill them, okay? In doing this, whatever it is you're not given, you need to be getting in touch with a doctor. It's a whole lot of work. It's annoying because because those things need to be rewritten, okay? So say someone is supposed to get Tylenol, which is not a priority. However, if it is for someone who experiences pain is another thing you want to prioritize. Then you want to be giving it to them. Again, you kind of get a feel. So say for instance, someone's supposed to get Tylenol at 9 p.m. and they got one at, I don't know if that's a good example though, because I don't want to have people start doing medication errors. I'm just saying I'm not going to prioritize Tylenol over Cavidolol. Does that make sense? That's your heart. Is that digoxin? Oh my God. I don't know. I don't want to be calling wrong things right now. I'm too tired. I just got back from work. But something to do with the heart. I'm going to prioritize the heart thing first. Now, that's not to say, you got to put things in perspective. That's not to say the person who's just getting routine Tylenol. Okay, that's the thing. Gets routine Tylenol. So if you skip that Tylenol in the scope of things, in the bigger scope of things, let's use me. I had 49 patients. So I'm going to be giving someone with digoxin their medication and actually checking the vitals and the parameters on that to someone who gets Tylenol every 9 p.m. in the greater scope of things. No, I'm not going to give that. Does that make sense? It doesn't make me a bad person. What I'm going to do, I'm going to document. Look, let me tell you this. If you didn't document, you didn't do it. You got to protect your license. So first of all, when things like that happen, first of all, I'm going to document. I'm going to make sure the DON knows, the unit manager. Okay, I'm going to do as much as I can. But the truth of the matter is, I am not superwoman. I do not want to be responsible for medication errors. In saying that, me not giving that Tylenol is a medication error. However, I'm going to let the nurse know. I'm going to let the doctor know. Like, okay, I held this or this was skipped, but we need to write it for another time or something. But I'm going to make sure I let the others know. Okay. So in my situation, 49 patients, it was overnight and they said someone was coming, Treatments wouldn't get done. Treatments as in wound dressing. It just won't get done. It's not priority. If we don't do that treatment just the one night, the person is going to die. What else won't get done? Let me see. It's interesting I'm saying this because, again, I'm keeping it real because we as nurses, we know, especially for those of us who work in the nursing home, we do know vitamins, tablets, well, they're not gonna. Okay. First of all, I don't even know why we're getting people up at night to give them vitamin D. I don't know. That's all the politics that happen where, people think, well, night shift has to do something too if we're giving something in the day. And I've worked day and I've worked night, so I get that. Another thing is, let me see, what else will get done? I'm trying to remember now. See, everything should get done, but in the greater scope of things. Some people are going to get more prioritized than others, okay? People who... I'm trying to remember. I had a list out, and I don't know where I put it. I was so excited with my light. You're just going to have to prioritize. Does that make sense? But I do know dressing's a big one. That is a no, I'm not even looking at it. Okay, day shift is coming behind me. Nursing, including CNA work, is 24 hours. So they're going to pick up the slack. Okay, day shift, they're just going to have to. I have 49 patients. Now, the same 49 patient has 3 to 4 nurses in the daytime. So don't tell me they were sleeping. That's not true. Because if they were sleeping and they didn't need us as nurses or CNAs watching over them, then we don't have a problem now, do we? But night nurses also have work they're doing. There are medications that need to be given. There are treatments that needs to be done. And then aside from that, there are other things, administrative things that you need to do. The pharmacist is coming, and sometimes you have a new admission. Don't get me started now, okay? But it's interesting because I worked day for like 15 years. 15 years, yeah. I don't know how I survived it, but I did. And then I was of the same mind too. Oh my God, I don't know what night shift is doing. And then I started working night shift, and I realized, oh, they do stuff. I should do a video about that, night shift and day shift. Okay, so don't panic. So these are for nurses. I'm going to do the CNA one. So do not panic. Let your CNA, because you're the charge nurse, let your CNA know that you've got their back, because they're going to come to you and they're sending things. Again, work together. Because I do not care for CNAs who say they did the work and they didn't do it. Look, let me know. Okay, I know you're human. I know you're not a robot. So let's work together. What are some of the things that you didn't do so we can document properly and be able to give a good report for those coming in? It doesn't matter what noise they make. My thing is, as long as you present and package yourself well, it will be fine. If they're not happy, well, you weren't happy either. Okay, that you had to have 49 patients to yourself. What kind of care can you get? So I'm going to do the CNA video, but right now I'm doing the nurse. Okay, you just need to prioritize. You need to get your heart medication. You need to get your blood pressure medication. You need to get your diabetics. You need to get the breathing treatments. You got to get those. Okay, things to do with breathing. You have to get those. Of course, if it is IV, you got to get your IVs, okay? That's priority. You get to those that, because again, when you're taking antibiotics or you're taking any kind of medication that is tied to time, you want to make sure you're getting those, okay? Those are the ones that if you don't do it, it's going to create some kind of imbalance where, you're messing with the person's life now. But when it comes to vitamins, it comes to wound dressings, it comes to Tylenol, those who need their pain medication, you got to be giving them the pain medication. Okay. So don't just think because I said Tylenol. No, I meant routine Tylenol. Some people get routine Tylenol just because it's part of their care plan. Okay. I'm not saying it doesn't work, but it's not priority now. Okay. But those who get their pain meds, yes, you have to take care of pain. I live with pain. Pain is something you don't play with. Okay. Those who get fed through the G-tube, again, you're going to use your discretion now. Some of them you can actually feed them bolus and you can hold it. Does that make sense? Where it's not like they're going to starve. You're just going to know that. Because sometimes there's some patients who they eat, but they're not getting enough nutrients. And so you supplement it. It's like you drinking, what do you drink? Supplements like vitamins. And sure, right? So for those also, it's not priority. Does that make sense? Now it's just a one shift thing. Okay, so it's not like every time you go, it's going to be that way. No, it's not every time you work, you're going to be short-staffed. Actually, it's every time. But anyway, you all know what I'm talking about. I'm hoping that I've helped you. Also, I did explain that this advice is predominantly for those working in the long-term care facility. In the hospital, short staffing is not the same thing as it hits the long-term care facility. In the hospital, there's a lot of floaters. They get people in right there. If it's a rehab floor, if it's a floor that, you have unstable patients, where everyone, if you have 49 patients, all 49 of them are on IV. You can't have one nurse there. It doesn't make sense. In fact, you should be calling the state and reporting them. I've got gist for you guys. But anyway, we've gone like 15 minutes already, so I'm going to stop here. But if you have anything to add, please do not hesitate. Please, please, please. This is something I'm probably going to talk about again. But anyway, hit the notification bell, subscribe, give me thumbs up, and I'll see you in my next video. Thank you.